Good afternoon, friends. We are back again, trying for the second time to do this great Facebook Live interview. We're here at the Pan American Health Organization, where we have ministers of health from every single country in the Americas. And we're honored to have with us the director of the Pan American Health Organization, Dr. Carissa Etienne, who's going to talk to us about some of the important things that the health ministers are discussing. As you know, public health is an increasingly important subject these days. We have not only outbreaks of things like Zika, malaria, and other communicable diseases, but we also have a crisis with non-communicable diseases, with chronic diseases. So at this directing council, where we have, as I said, ministers from all over the Americas, we're going to speak about some of the most important health topics in the Americas and globally as well. So I'd like to ask Dr. Etienne, as you know, Carissa Etienne is the director of the Pan American Health Organization. What, in your mind, are the main topics for this directing council?
Thank you, and good day to the Facebook lovers. Certainly at this directing council, which is the 55th directing council, we will be discussing with many of the member states important agenda items. One of them is the financial report of the organization for the biennium 2014-2015. And this is important. This is how we give an account of our stewardship of the finances of the organization. As well, we will be looking at a number of technical agenda items of importance to member states. We will be looking at the whole question of arboviral diseases. You'll know that we have had dengue, which has been endemic with us, yellow fever as well, endemic in some countries. We have seen the outbreak of chikungunya and now Zika disease. And we believe that it's a time that we take a holistic look at these arboviral diseases and begin to examine what are some of the key strategies to deal with this. And we think that that's going to be very, very important. As well, we would be looking at the elimination of malaria. We have 21 endemic countries. We want malaria not to have malaria cases in the region of the Americas. As well, we will look at the resilient health systems. We have a policy paper on resilient health systems. You will recall that after the Ebola outbreak, that most people were speaking about the fact that we need resilient health systems. We need resilient health systems not only for emergencies, and this is the first time that we will seek to define what are resilient health systems and what are the important components. Resilient health systems need to be health systems that can deliver quality care in an efficient manner and certainly at a cost that people can afford. And so this requires us revisiting universal health coverage, universal access to health, but also as well, how do we ensure the preparedness? How do we ensure that the essential public health functions are also taken into consideration? So this is an agenda item we feel that will generate a lot of discussion. Very importantly, the access to high-cost medicines. You will know that many countries in our region are struggling to find the resources to pay for those high-cost medicines. And the Mercosur region has embarked on discussions for joint negotiations and buying through our strategic fund in PAHO. And so we believe that this is going to generate some discussion as member states begin to grapple with this issue and how best to assess technology, how best to buy these medicines and technology. Importantly, as well, I think let's see. we have WHO reform. And one of the things with WHO reform is a framework for the engagement with non-state actors. And this was passed at the Assembly in May of this year, and this region will have to align to this. This is a guideline and a framework that will determine how we work with the private sector, how we work with civil society, non-governmental organizations, how we work with academia, and how we work with foundations, and would ensure that there is no conflict in those relationships. And this is very important for the work of the organization going forward. It's very important since such a significant component of our financing is from that sector. So that's going to be extremely important. I think also that we will have an agenda item on disasters and our response to disasters. This region is the second most important region in the world when it comes to disasters. Only this year we faced some 9 disasters in our region, and ensuring that we are well aligned and prepared to deal with emergencies and to respond to them is going to be very, very important. So these are some of the agenda items. We will be reporting on many of the resolutions and plans of actions that we have had in the past, and reporting on midterm, but also end of plan assessments.
Dr. Etienne, we saw that you this morning were with Dr. Margaret Chan, the director of WHO, yourself, and a minister of health outside at an exhibit on neglected infectious diseases. Can you tell us why some of these neglected infectious diseases are important for public health in the Americas and what we hope to do about them?
Well, neglected infectious diseases cause much pain and suffering, but also they affect some of the poorest of the poor in our region. But there are conditions for which there is treatment. These can be treated with very low-cost interventions. But because they are associated with poor social conditions and poverty, it is important. We see many of these conditions causing stigma and discrimination for the people who suffer from them. And PAHO has an initiative to eliminate neglected infectious diseases from this region. And we have a report on this, and based on the report we have an exhibit with some photos, but we also have a little hut with the dirt floors, because that's the condition that also generates a lot of the exposure to those neglected infectious diseases. But this is going to require an approach that talks about equity, an approach that targets the vulnerable populations, but that involves a multi-sectoral approach.
Yes, we're back with Dr. Carissa Etienne from the Pan American Health Organization on this Facebook Live program. And as she mentioned, we have a little hut with a dirt floor outside, something that I doubt many people in Washington have ever walked into or experienced. So it's good for us to have a little empathy and knowledge about the living conditions of many of the world's poorest people, and especially the poorest people in Latin America and the Caribbean affected by these neglected diseases. But Dr. Etienne, you also mentioned arboviruses, and I'm not sure that many people know what an arbovirus is. Can you explain to us the importance of why we need to take an integrated approach with arboviruses? Does that include Zika and dengue? Does it also include malaria? What are our plans? What can we really do?
Well, these arboviruses are spread by mosquitoes of various species, but very importantly, the Aedes aegypti mosquito. And we unearthed a resolution since 1947 that calls for the eradication of Aedes aegypti mosquito in this region. So we've been fighting in this region to eradicate Aedes aegypti for many years, a long time, 60 years, and we've not been successful. And in fact, we are seeing even more infestation with Aedes aegypti. So this is an attempt not to look in a fragmented manner at all of the various diseases, to have a strategy for Zika, a strategy for chikungunya, a strategy for yellow fever, but to bring an integrated approach that says that we recognize that the mosquito is the problem, and that we need to focus our attention at if not eradication, but certainly reducing the level of infestation from this mosquito and other mosquitoes in the region.
So the Aedes aegypti mosquito has been the main transmitter of Zika virus, and Zika virus has become a serious problem for us in Brazil, in Colombia, and some other countries of the Americas. What are we really able to do about Zika virus in addition to fighting to reduce mosquito populations? Is that our best solution at this stage?
Well, as you know, and as many of our listeners know, Zika is a mild infection. So many persons who have Zika don't know that they have Zika. It's mild. But the problem is that it's the sequelae, the complications of Zika. And it is, for the great part, the microcephaly that we see, and the neurological deficits in newborns that we are seeing, but also the Guillain-Barré syndrome that leads to temporary paralysis, but also can lead to death. We have had some deaths from the Guillain-Barré syndrome. So that's the important reason why we focus on Zika. And so for this region, it is important. Most of our territories have reported, some 47 countries reported Zika transmission in the region. We have many countries that have reported Guillain-Barré syndrome, and countries increasingly reporting increased levels of microcephaly. So it's important. The long-term effects of these effects on newborn babies, that is going to continue through their lifetime. And we have to decide how best to accompany these families, what best to put in place, both to prevent that happening, but also to take care of those. I mean, so we know, however, that the vector for Zika is the Aedes aegypti mosquito. And hitherto we've used the traditional methods of communicating to people, dealing with the environmental approaches, fumigating, reducing the mosquito breeding sites, but we have not had much success. Aedes aegypti is present in most of our countries. Somebody said in the United States of America, in Washington, D.C., they found the Aedes aegypti mosquito in a hotel. So it is ubiquitous. And since we have failed thus far, we need to look for innovative technologies to be able to address it.
Dr. Etienne, you also mentioned malaria. Are we talking about now a plan, and I think our Facebook friends would be very interested in knowing more about this, a plan to eliminate malaria? Are we anywhere near the possibility of being able to eliminate malaria in this hemisphere, or to reduce it substantially?
I must say that we are at a stage that we have already reduced significantly the incidence of malaria in our region. We have 21 endemic countries, and in many of those endemic countries, we have had successes in reducing malaria. We continue to have a consolidated effort around Central America and around the Guyana Shield countries. But the evidence shows that we have made significant reductions in malaria. We need to redouble our efforts to ensure that, particularly in our very remote areas, that we help to reduce the exposure to the Anopheles mosquito, but at the same time that we provide effective treatments for all of the peoples who are affected with malaria. We need also to ensure that we do not cause antimicrobial resistance to antimycin resistance to mosquitoes, because this is the last drug that we have, the antimycin, and this is the last drug that we have to address this problem in a very effective manner.
Dr. Etienne, you mentioned antimicrobial resistance, and I know there was a big effort at the United Nations, a special meeting, really only the fourth such meeting to ever have been held, to discuss a specific disease, to talk about what we can do to reduce antimicrobial resistance globally. Do you think the efforts that have been made are enough? What else can we do that we haven't done? Or are we really in the throes of a dangerous situation with no more antibiotics available?
We are in the throes of what is a very urgent and serious problem. The world is facing the possibility where we will not have antibiotics, antimicrobials for some of the most frequent infections. We are reaching a point where it will be impossible to do surgical interventions because we don't have the antibiotics to use. So it is urgent. It is urgent. I don't think that we are doing enough. We continue to see the use of large quantities of antibiotics and antimicrobials in the veterinary industry, and we need to address this. We need to address it within the whole concept of One Health, with working with the Food and Agriculture Organization, OIE, and WHO. But we need to have the practices supported by new regulations that would allow us to confront this. But as well, we need to stimulate the research and development that is required so that we can have new antimicrobials in the pipeline. But it is serious. It is serious and it is urgent. And this is, I would think, the very reason why in the UN General Assembly it was considered in the margins.
Yeah. Do you think, Dr. Etienne, switching from antimicrobials to kind of communications and messaging, do you think that social media like Facebook and others can have some effect on teaching people or educating people about some of these public health programs and some of the problems that we've had with antimicrobials? What can we tell people individually to do, and what methods can we use to tell people how to combat antibiotic resistance?
Absolutely. I think social media is essential. It's essential for the sensitization and the education of the public. Social media reaches so many millions of people in such an effective way, more effective than we can with any of our programs. So social media is an integral partner of the fight in public health. And certainly for antimicrobials, we need to get people to understand that over-the-counter antibiotics is bad and should not be done, that ordering antibiotics over the internet is bad and shouldn't be done, because all of this leads to resistance. When you are prescribed antibiotics, you need to complete the dose and not stop it after a day or two when you feel better. You need, in your discussion with your primary care physicians, you need to bring up the topic of antibiotics use and whether it is essential that you take antibiotics for what you are presenting. I believe that it is not just the health sector. I believe it's a multi-sectoral approach in which the individual also has an important role to play, and social media, of course. So let me thank social media for continuing the discussion around antimicrobial resistance, but other public health issues in general.
Okay, I think that's a good point at which to say thank you to Dr. Etienne for this, which we hope will be the first of several interviews we are doing during this PAHO Directing Council with Ministers of Health and other health authorities. And we hope to hear more from you and the other health authorities in the days ahead. Thank you very much, Dr. Etienne.
Thank you, and thanks to our listeners. Thank you very much.